All right, so hello everybody. Thank you very much for joining us. Okay, so thank you very much. I think we are 2 minutes past the hour so that we don't run over time. I think we are in a good place to begin. I'll just start by introducing our speakers for today. And then, so I want to make sure I can move my slides. All right, thank you. Okay, so just to confirm, everybody can hear me and can see my slides.
Yes, I do.
Yes. Okay, thank you very much. All right, so welcome to the AORTIC Pediatric Oncology Special Interest Group webinar. Let me begin by doing a bit of an introduction about AORTIC. So AORTIC is the African Organization for Research and Training in Cancer. It is the largest cancer NGO in Africa, dedicated to advancing cancer control and improving outcomes through research, through a lot of education, training, advocacy, and international collaboration. So the Pediatric Oncology Special Interest Group is a very young group that just began last year. AORTIC has several special interest groups across radiation oncology, hematological cancers, clinical trials, innovative medicines. And the Pediatric Oncology SIG began last year to bring together people who are working in or interested in pediatric cancer on the continent. And the goal of the SIG is to support knowledge sharing, to build capacity, to connect people across a network for multidisciplinary collaboration, and really ultimately to strengthen pediatric oncology, expertise, proficiency, and access to care in Africa and other low and middle income settings. So we thank you very much for joining today's session, and we'll welcome you. I'm going to just do a brief introduction of our speakers today. We can't do a proper introduction because it will take more than a page to introduce the speakers. But I'm going to first start by talking about Dr. Manu Bacta, who was born in Zimbabwe but emigrated to Africa from India. Emigrated from Africa to India and then to the US several years ago. So let me just say on a personal level, how I met Dr. Bacta was that I sent a cold email. I sent a random email to maybe 4 or 5 people. Many years ago, I was starting a pediatric oncology MDT, and I needed an expert to join us in our MDT and contribute and guide us. And he was the only one. I mean, he had never met me before. He didn't know who I was. I just sent a cold email, introduced myself, said why I was writing, and he was the only one who responded to the email and joined the MDT, taught us that day, and has always been available to offer knowledge, to offer support, to offer encouragement. He's highly respected, very, very loved, and it's a real honor to have you here with us, Dr. Bacta. Thank you very much for making the time to do this. I will also talk about Dr. Miguel Bonilla, a pediatric hematology oncologist with extensive global pediatric oncology experience, has done a lot of work strengthening childhood cancer initiative in LMIC settings, is an independent consultant with the ARIA Guide program at St. Jude Global. And the goal of the ARIA Guide program is to develop resource-adapted guidelines so that, when you struggle to be able to follow the guidelines that are standard of care because you don't have certain things, so you don't have molecular testing or you don't have access to certain tests, you don't have access to certain medicines, you have a resource-adapted guideline that is valuable and can still be used in your setting. He has supported pediatric cancer program development in multiple settings, multiple countries, held leadership roles across multiple settings. And again, really grateful to have him give his time today to speak with us. So just before we begin, housekeeping. This session will take about 60 minutes. We'll have QA at the end. Please stay muted. If you want to ask a question, please put it in the chat, and your question will be answered at the end of the talks. The session is being recorded for educational purposes. Thank you very much, everyone. And to join the AORTIC Pediatric Oncology community, we'll put up a barcode maybe during the break in the meeting that you can scan and join, and then we'll share a link in the chat so that you can join our Pediatric Oncology SIG community on WhatsApp for notifications and things like that about AORTIC activities that are coming up. Thank you very much, everyone, and let's enjoy the session.
Wonderful. I'm going to share my screen. Hi, everybody. I'm Monica. I'm the Senior Program Manager at the ARIA Guide. Oh, go ahead. Can everyone see my screen? Great.
Yes.
All right. And I'm going to introduce again Manu and Miguel and take it from here. Here's the ARIA Guide, and I will proceed through our information. Here's a quick review of our agenda for today. Welcome and introduction, which we've started. Thank you so much. Overview of the ARIA Guide, portal navigation, and then a case study regarding Hodgkin lymphoma, and then our Q&A. Here's our welcome. We've gone through. Our introductions have been made. And Miguel and Manu, I believe we start here, correct?
Yes.
Thank you.
Can you go to the next slide? Thank you. So first, we wanted to start saying thank you to AORTIC for the invitation to share ARIA with you today, because for us it's very important that AORTIC, as a very significant organization in Africa, is more connected to what we are doing in ARIA. In our mission, you can see that our mission explains why ARIA was created, reflecting the main purpose of ARIA. And the goal is to support better decision-making for children with cancer wherever they live. So that's the mission of ARIA. Can you go to the next slide, please? And in the vision explains why ARIA was created, reflecting the main purpose of ARIA to bring together global expertise. And when we refer to global expertise, we say that each pediatric oncologist anywhere in the world, regardless of the access to resources, is an expert in treating cancer, because he's the person who is taking daily decisions in their setting. So the idea or the mission in the vision in ARIA is to bring together that global expertise to develop guidelines. And the goal is to support better decision making for children with cancer wherever they live, anywhere in the world, at any time. Next slide, please. In this set of values, we wanted to demonstrate that we want that ARIA become a reliable, practical, useful in clinical settings, accessible to healthcare providers everywhere in the world. So the idea is to bring the information accessible to the place where children with cancer are being treated. Next slide, please. And what are the objectives of ARIA? In ARIA, we said that we have two main products. One is the documents. We use a name for that, is the Adapted Management Guidelines, or AMGs. That's one of the products of ARIA. The other product is the portal. It's a website portal that can be used to become accessible, the document that we are developing, more accessible everywhere, because it's a dynamic place where the information can be accessed free. Every doctor, nurse, pharmacist, they can access the information, just need to register in ARIA and they can access the information that we are developing in the documents. Next slide, please. And ARIA was established early in 2020 as a collaboration between St. Jude, Global, SIOP, in working in partnership with very important groups in pediatric oncology, like IPSO, the Society of Pediatric Surgical Oncology, PROS, the Pediatric Radiation Oncology, and Childhood Cancer International. And together, all these organizations share the same goal: to support the WHO Global Initiative for Childhood Cancer and to improve the care for children with cancer worldwide. Next slide, please. And this is, for us, this is a very important slide, because we know that many times what is used as a protocol actually is a treatment plan. is what is expressed in number one. Treatment plans that can be accessed by a publication or report of a group who conducted a clinical trial and then reported the outcome, and then also included treatment plans. And many times institutions use that information as a protocol, but it's a incomplete information about how to take decisions, what to do in a daily based situations. And what is a protocol? A protocol is what is in number three. A protocol is a document to conduct a research, usually to answer a question, comparing one treatment to other or what is better. So in ARIA, we are dedicated to develop what is in number two, guidelines, because we wanted to provide comprehensive information, including all the details that is possible to be presented, what to do in particular situation, how to substitute drugs, how to modify drugs. And the idea is to provide comprehensive information, but not conducting a clinical trial or not answering a question. So this is important for us that you keep in mind that in ARIA, we are not developing protocols, we are developing guidelines. Can you go to the next slide, please? And this is a comparison between what is a protocol and what is a guideline. And in a clinical trial protocols, those, as I said before, those are designed to specific research questions. And treatment guidelines are designed to support clinical decisions in daily clinical practice. And it's important because this distinction is important because in ARIA, as I said before, we are not creating protocols. And I want just to emphasize this because many times when people start using what we have in ARIA, they say, but I don't have this in whatever resource. And the answer is there, is in ARIA, what to do if you don't have this drug, but you can substitute by other drug. Or you don't have this access to this laboratory, but you can resolve that by using a proxy, or you will see when you start using ARIA that we are offering options for daily based situations. So keep in mind, as I said before, that ARIA is guidelines. We are not developing protocols. In summary, protocols are intended to generate knowledge. The guidelines are intended to guide daily care for children with cancer in this case. Next slide, please. And this slide is like a classical slide explaining why ARIA is developed in a concept of global participation, because we believe that if we develop guidelines with global participation, as I said before, experts around the world providing inputs to develop the guideline, that guideline with a global context can be accepted in a regional country and then hospital. If we go in the other way around, starting developing guidelines, each hospital, it is not applicable for another hospital, even in the same region, same country. So the idea in ARIA is to start global in order that we can facilitate adoption of the guidelines in a global, in the regional, country, and then hospital. In that way, time is going to be reduced, and that time is going to be used for learning about how to implement the guidelines. And that is something beyond just developing the guidelines. Can you go to the next slide, please? I mentioned before also that in ARIA we have, let's say, two main products, but first, we develop the documents, the AMGs, the Adapted Management Guidelines, and also the clinical practice recommendations. We are going to explain today what is AMGs and what are CPRs. And also, we are also developing the guide portal, the website where the information that is included in each of the documents can be accessed in a more dynamic way because each of the guidelines, lymphoblastic leukemia or Hodgkin lymphoma, having more than 100 pages is a long document because we include comprehensive information. But accessing that information through the website portal is more dynamic because it clicks, you can move from one part to the other part of the guideline, and you will learn about that today because we are going to do a demonstration. What is that? So important. There are two main products, the documents and the portal. Next slide, please. What are the AMGs? The first product that I mentioned, the documents. Those are the Adapted Management Guidelines, or the AMGs, and are stratified guidelines customized for each disease. They are based on specific resource availabilities. And that's what is one of the major values of ARIA, because we are going to demonstrate today in Hodgkin lymphoma, many settings don't have access to radiation therapy. In others, they have access to radiation therapy, even in the same country or same region, and they can treat children with Hodgkin lymphoma, whether they have access to radiation therapy or not. ARIA is presenting information that can be used to treat with or without radiation therapy, or with PET scan or no PET scan. So we develop guidelines based on access to resources. And each treatment plan is presented with the resources required for that particular treatment plan. That's the AMGs, the document, the first product that I mentioned before. Can you go to the next slide, please? And in our consultation approach brings together global participation. I mentioned this earlier also, saying that the idea is to bring together global participation, global expertise, in order that we can create a document that is more easy to be implemented. And this broad participation helps to ensure that the guidelines are clinically strong, globally relevant, and appropriate for different resource settings. So you see here different organizations that have been participating in the development of different guidelines. Can you go to the next slide? And this is just to show you that we have a consistent methodology. We are not just writing guidelines for writing. We have a methodology. How we start, we identify what is the disease that we are going to start working. We create the different groups that are going to start reviewing literature, then writing the initial draft, and then conducting reviews first with what we call working groups, a small group of people around the world that is going to start drafting the first document. Then we go to a global group, a bigger group with a participation of globally. And then we conduct our iterative review process. Several times we review the same document, make corrections based on the feedback. And when that is finished, we have the final draft. We share that to external experts. And that is, what is that? We identify experts in that particular disease who have not been participating in the development of the guideline. It's going to be first time that they are going to review what we have drafted, and we have a specific question for them. If we have over-adapted, if we have missed important information, or if there are some ethical concerns about what we are doing. And then they provide their feedbacks, and based on that, we develop the final document. When the final document is finished, we have already started sending the information to the portal, to the website, in order that the information be presented in the website portal. So we have a methodology. That's the idea of this slide, that we are doing each guideline in a consistent way. Can you go to the next slide? And this is the methodological framework for the clinical practice recommendations, that is for supportive care, palliative care. They have developed this process of for developing those documents. Is in the same way, bringing global participation to create robust document. Can you go to the next slide? And this is another way to present how the clinical practice recommendation, as said before, supportive care, palliative care. This is the representation of the steps that they take for developing those guidelines. And can you go to the next? And for us, these slides show the process for the development of the documents. So we start developing the content, as I said before, and then reviewing, and then adapting, and then finally making the document available to the portal. And we conduct also beta testing to explore what users see or user interface and what users do, that is users experience. In that process they provide feedback also saying, the portal is nice, well presented, but maybe it can be more dynamic if you move this information from here to there, or you miss something here. And we are constantly editing the document that is in the portal also, in order that the document be updated and more practicable for use. So, in that methodology, we have roles. We have the disease coordination lead, and that is the person is an expert in what particular disease is going to lead that group. I said before also that we have a working group as a reduced group of people who are going to start reviewing the literature and then conducting the meetings for start drafting the initial document. And then we go to the global representative panel. They provide feedback, review the document several times, and then we go to the external expert. What we are trying to present to you today is that we have a methodology. We are developing the guidelines based on methodology and not only based on what we believe it is something that has to be included in a guideline. Can you go to the next slide? Next slide. So, this is the documents that we are working in the group of disease. We have 26 disease planned. Here is an example. And in non-disease, we have a significant number also in supportive care, palliative care, survivorship. Can you go to the next slide? It's easier to. And that's, you see, we are planning to develop 26 disease guidelines, 62 supportive care guidelines, 12 palliative care, 20 survivorship. In total, we are going to have 120 guides. And then we are going to present all that information in the portal, as I said before. Can you go to the next slide? And now, I think we are okay with the time. So Manu, it's your time for do a demonstration, and then I'm going to present a case of Hodgkin lymphoma just to be more interactive in the way that we are using ARIA. Thank you.
Thank you, Miguel, for that really good, comprehensive outline. First of all, I just want to say I was thinking of you all, and yesterday was Africa Day, and this is the ARIA moment. So this is a kind of a fun thing for me to be able to join and be kind of involved in this AORTIC conference. This pediatric conference that you all are having in order to bring everybody together and network and so forth is critical. And I think our goal is for ARIA to also facilitate that in many ways. Miguel gave an excellent background information, and now we're going to get down to the details and show you the actual portal that we call, or the website where this guidelines will be available. I'm going to go ahead and share my screen. Okay, I'm just going to clear up some things here so I can. Can you see my screen?
I'm seeing a Zoom.
Yes, the Zoom.
The Zoom, okay. Ah, your screen sharing is paused. That's weird. I'm going to stop share and start again. I see a message that says your screen sharing is paused. Let me try again. Okay, can you share?
Yes. Yes, Manu.
Oh, good, success. Um, it's always when you really need something, things can go wrong. But
Excellent.
so this is the when you log into ARIA, this is a screen that comes up right now, the way we've kind of designed it. I want to say that first of all, the ARIA program is a program that it has to be set up by an individual organization that can be a hospital or institution, or could be a group of hospitals that are networking with each other, and you could set up a ARIA program specific for your setting. And the way to do that is to go to a account settings. And when you go to account settings, what happens is that you'll have your, so you register with ARIA and your hospital name and site will come up here. And once this is added, then you go through, and this is a registration process that you would go through. And what happens is that okay, so when you click on that, you get a list of all the different resources for pathology, for each specific disease, for radiation, for supportive care and nursing and so forth. You would identify two or three um, people who will be in charge of the edits that will kind of add what resources that you have available. Now, these are resources that are available that are going to be, well, ARIA will look at those resources specifically for each disease because we know that you need different sets of resources for different diseases. Also, the resources can be the type of resources that you may have access to. For example, we know in many places in Africa, well, where you would have to refer patients to private for, say, for radiation, or private send uh, blood work for specific testing in private, or sometimes have patients go to another city or a facility and come back to you. So if that were the case, then we say those resources are available for that patients, and the treatment guideline is then based upon availability of all those resources. And when you go to ARIA Guide, once you set that in, once you get your resources set in, then what you do is you invite people to join your group. The ARIA program now belongs to you. It's not a St. Jude developed ARIA program or PSYOP. It's customized and specific for you because of the way you set it up. You invite people to join, and with their email, and they select their password. And once they do that and they go to ARIA, little ARIA will automatically come up with all the settings that you have already put in for your group. So it can be junior doctors, can be surgeons, radiation therapists, social workers, nurses, pharmacists. They'll all access the same um, guideline. And so everybody's then working off the same page. Now, one other part of ARIA that's important is that from the beginning, we've set this up so that it can work on a desktop, on a laptop, or a iPad, or even Android or iPhone. The screen automatically adapts and adjusts to the device that you have. And what we also recognize is that there is a need for us to make this program practical, and that there's a testing done we have a large group of IT that's working with us very closely, and they do testing to make sure that even in a low internet signal environment, that this program is stable. If you lose connectivity, then we have what's called uh, the most recent program from Microsoft called Microsoft Couch that's embedded through your browser, and the program will then run as an app, and you can still continue to use it. So if you go to a clinic or parts of your hospital or somewhere else where you do a outreach clinic, you can still have the ARIA program available to you. So all these aspects have been thought through. Now to get to the specific details of ARIA, right on the top menu is it's a list. Select a disease is where you would go in and select your diseases. There's Care Book. Care Book is a resource. It's more like a oncology handbook where you can go in and get information like DIC, fever, neutropenia, veno-occlusive diseases, treatments for specific treatments for chemotherapy-induced nausea and vomiting, and so forth. Like if you go to fever neutropenia, it'll help people to define the risk, and also it will lead you to both to details in terms of initial assessments and so forth, and it takes you to the pathway and provides you with what type of antibiotics that are needed empirically and how to care for the patient. So there's a lot more details in here. And it's like risk stratification. You go to initial assessment, management. There's a dosing tool that will allow you to calculate doses of antibiotics. And then once the patient is started on treatment, how do you follow the patient? What do you do if they have prolonged fever? When do you stop treatment? And so forth. So these are supportive care guidelines are very practical. It's like Miguel said, it's interactive, dynamic, and you can kind of navigate through based on your patient at the bedside. Palliative care information, and once again, you can click on any of these specific problems, and you can come up with guidelines. And this allows you to go through and get the detailed guidelines for pain and some treatments and so forth. Same thing we're also building for survivorship. Once they finish treatments, and at a certain point, we define these patients to be survivors of childhood cancer, but they're at risk for ongoing toxicities that they had encountered, and what are the special things that are needed to be monitored and taken care of, and the patient taken care of. So this would be in the survivorship guidelines that will develop. On the top menu, we also have care tools. Care tools are like calculators where you can go in and do staging, and in this case, Hodgkin's lymphoma staging, and I'll go through the staging when I show you the disease part, but you can do the staging and it'll give you the stage on the basis of you just answer the questions through here. Also, there's some background information about the staging. Something that the junior doctors it'll be very helpful for them to have this available. We also feel that the MDTs are very important. So what we've done is given a benchmark of some of the specific MDT information that needs to be at least addressed and reviewed. So with the surgeons, the radiation therapists, and the pathologists, and to come up with a practical plan for that patient, taking into account local circumstances. So what we have here is care tools. Then there's a library where we will keep all the PDFs for what Miguel described as being there you got the disease-specific supportive care, palliative care, the PDFs available. Then there's in process of development collaborations, which is more like a social channel where you can go in and pose any problems you may have for any specific disease with your patients, and you're looking out for input from outside. And globally people can review and interact with each other. So this is one way of networking through the collaboration site. So what I'll do at this stage is go to and we're going to use Hodgkin's lymphoma as our test case. So when you click Hodgkin's lymphoma, it'll take you straight to the treatment. The reason we did that is because most of the patients that oncologists see are established patients coming in for repeat visits. But when if you have a new patient, then you go right to the beginning to pre-evaluations. And over here, it'll give you the recommended tests, both what are the things to look for specific for Hodgkin's, then document for clinical exams, laboratory, imaging, and any other aspects that are important to consider. We also provide at this point details for pathology, because most patients undergo a biopsy at the outset. And in pathology, there's a comprehensive information. In this case, depending on what level of expertise there is, what are the potential immunotypes that you can measure, and what is the estimated accuracy for the different immunotypes. And these are all for the specific things for the pathologist to kind of review. We have general information about Hodgkin's lymphoma, and this is very helpful for junior doctors in particular if they want to learn more about it. So when a patient first comes, there's often considerations of differential diagnoses, and we provide a list of differential diagnoses that may be considered for patients who present with likely Hodgkin's lymphoma. So once you got your pre-evaluations and you have all the data from your pre-evaluations, within a few weeks, we expect you to be ready to start stage and risk. And when you go to stage and risk, that's what I was showing you earlier on. We have it built in for each disease as well, where one could go in and check if the patient has lymph nodes that are single or multiple. And when you click on details, it gives you more information. In these cases, we also provide diagrams for where the lymph nodes are. And there's one side of diaphragm or two sides, both. This is the classic staging. If there's an isolated metastatic sites, are there B sites, B symptoms present? Is there extralymphatic extension? Is there a bulky tumor? And I'm just going to, this is a classical Hodgkin's, so nodular lymphocyte predominant. Then you submit, and it'll give you a stage, and also give you the other variables that are important for considerations of treatment. So you can do your staging, and then you can go to treatment. Now, I want to say at this point that we've also on this what we call second level menu. We have surgery and radiotherapy, because we realize that we don't want to get into stage 3A treatment plan for the surgeon to kind of navigate ARIA portal to find their information there. So we want general information for the surgeons for Hodgkin's lymphoma and for radiation therapy to be available at this level. So when the surgeons use this, they'll go straight to surgery once they select their disease. Then it'll provide them with more detailed information that and special considerations and so forth that they may need to take into account, and aspects of complications. Radiation therapists will find tremendous amount of information here, and in terms of treatment delivery, target volume and dose, constraints like Pentec table about normal tissues and the constraints of radiation therapy, and all about dose fractionation and so forth. And I think Adedea would probably find this very interesting to navigate. So once you go to the treatment, after you got your stage and risk, what ARIA program does is it will automatically look at the resources that you have set in for the diseases from the outset, and will automatically know for your resource that you may be eligible for, say, stratum C. We call these strata from A, B, C, D. Some diseases may have E, some may just have A, B, C. So it depends on specific disease. The critical information needed that is based upon what is the extent of your path evaluation. We look at what are the specific information that you have available to you to be able to do stage and risk. What are the treatments that you may have available in terms of radiation and so forth? So when you click that small I, you will have the absolutely required variables for you to be eligible for each of the strata. And this comes out of the initial information that you put in your settings, and ARIA will evaluate that for this disease and will provide the stratum as your default. Now, we know that the resources can vary. Radiation therapy machine may be broken down, your CT scanner may not work, and so forth. So then you have the ability as a physician at the bedside to evaluate what you have and change the stratum level for the specific treatment, so that this is not locked in. It's can be adapted for the specific patient. Or the patient may go sometimes from Africa, they may go to India for the initial evaluation treatments and so forth, or even sometimes stem cell transplant and come back to you. And once they come back, then you can say this patient has had this resources, and you can select the appropriate stratum for ongoing patient care. Now, there's disease subtypes, nodular lymphocyte and classical, and you can click and get the specific type of Hodgkin's lymphoma that the patient has. So most of them are going to be classical. So when you go there, and then you come up with an algorithm. We made this pretty easy to navigate. So if it's a Hodgkin's lymphoma stage 3A, then you go to stage 3 and you say with the extension or bulk or none, then you go straight to a treatment plan, HOD C2. So we've designed these treatment plans in specific way. The first 3 alphabets are always disease. The second alphabet will be this resource level, and the number will be the treatment plan. And so then what you do is you click on that treatment plan, and it takes you straight to that treatment plan. Now, before I go to that, I want to also mention one other thing. And here we have what's called TCS. That's a total care survival. Total care survival means if the patient doesn't have abandonment, a lot of delays or missed treatments, then if the patient has total care, then the expected percentage of survivability are the following. And Hodgkin's lymphoma, in this case, we expect a pretty good, over 75% of event-free survival for this resource level. So they're all colored green. If it's a different percentage, then the colors will be appropriate. We found this to standardize this for all the diseases so that nurses will be able to know what the potential outcome is for the patient. So will the social workers, so will the junior doctors. And it will help everybody to have the same messaging to the families and be able to emphasize total care, and so that the families realize what is their probability and also the potential to persevere, to go through this difficult journey of cancer treatment. So once you have this treatment plan identified, then this is a treatment summary. And the treatment summary goes, and this can be printed out. You go to a section here called Export on Top, and it'll print out a page, which is a practical page that has designed differently from this, but there'll be date next to these chemotherapy regimens. There'll be a place to put your comments, so that what dates of chemotherapy were given, what are the complications, if there were delays, what could be the reason, if there are complications such as chemo-related complications, then you can list all that. You can go to early response assessment, and this is another tool that we have where you can go in and click that, and you can answer the questions, and it will tell you if the patient needs radiation or not, or depending on the staging type as well. And you have, after evaluation, further chemotherapy and radiation therapy, in this case, only for inadequate responders at the time of early response assessment. And this is where you would go ahead and identify that. At the end of therapy, there will be details for what are the end of therapy evaluations that are needed. And over here, you can see that there is significant information about what needs to be done for end of therapy follow-up. Now, if you do not, by practice, use OIPA, or you do not have the drug, and there is an alternative regimen that you can use, and that would be ABVD. And if you click that, then you get all the ABVD cycles. And most people are very familiar with ABVD because historically this was one that has been in play for a long time, even before OIPA. So you can access these chemotherapy regimens as well. Now, if this patient comes in for, say, cycle 4 of ABVD, then you click this ABVD, and then what happens is that you get a specific cycle 4 treatment page, and it tells you what's the criteria to start, how long is the cycle, you put in the height of the patient, the weight of the patient, and you immediately, I should probably do, let me be a little more practical. And then what you'll get is a BMI, a BSA, and tells you what your recommended evaluations are. It automatically calculates out the doses. And here's the dosage. How do you give it? There's information for the nurses here. And in this case, it's a slow IV push or infusion over 1 to 15 minutes. And be very careful to avoid extravasation. When you click on these hyperlinks for the drugs, then the PDF opens up with all the details about the drug and toxicity, expected monitoring, and so forth. If the patient has liver toxicity and has a specifically elevated, say, bilirubin, and then you put that in there, then the program will automatically modify the dose. In this case, it would be doxo and dacarbazine, and vinblastine dose would be modified. And you can see that the doses have been modified accordingly in this bottom table. And if you click on this hyperlink, it tells you for these drugs, this is the percentage total dose that is modified. If the patient has the same thing for creatinine, it will be for different drugs. It will automatically change the dosage so it's appropriate for that creatinine to be able to administer that drug. For example, if you're below 30 for carboplatin or cisplatin topotecan, then it will just tell you to hold that drug for that treatment cycle. So this is all automated now. So when patients present with hepatotoxicity or significant renal impairment, you put in the values here, and the ARIA program will help you to determine the dosage at this stage. Now, what we also have, and we haven't yet brought in the specific subtitles and the headers from the care book into the supportive care and survivorship. And this will be specific, important ones that will be necessary, say, for Hodgkin's lymphoma in supportive care and for survivorship. And that will be automatically kind of populated in these tabs so that when you use that, then you can go there. Now, the one last thing, I know this is taking a long time, but the one last thing I wanted to know is that if you have many patients and you have Hodgkin's lymphoma and you go there, then what happens is that when you are in treatment, or if you're right on the top and you have a new patient, you can search and you can type in your plan ID, and it'll automatically bring in your treatment plan, and you're right there, and you can start. Because when you're in a clinic, it's easier to kind of just go to, because you know what treatment plan the patient is on, and it's easy to get to that. So I'm going to stop at this point and just wait to see if there's any questions. All right. If not, then I'll stop sharing.
All right. So thank you very much, Dr. Bhatta. That was really, and Dr. Bonina, that was really comprehensive. So I really appreciate the fact that you spend time explaining the process of the guide development so that everyone understands that this is a very inclusive process. And often notices actually go out to people that are interested in contributing to the guide. So if that's something that you're interested in, perhaps you might be able to reach out. And then also, if you would like to be able to access the guide, if you have any difficulty being able to access the guide, feel welcome to reach out as well. And that would be sorted out. I don't see any questions in the chat. We've put a message in the chat for you to join the Pediatric Oncology SIG community on WhatsApp. So if you'd like to join, please click on the link, the last message that was sent. Click on that link to join the community. If there's any questions, feel welcome to reach out via email or anything after this meeting. And if you're interested in implementing the guide in your setting, in your site, in your group or community, your MDT, for example, feel welcome to any of the speakers on this phone call. Would be happy to on this webinar. Would be happy to support and to guide you through it. So thank you again, everybody, for joining this morning or afternoon, depending on where you are. I will hand over now to Belmira. Is Belmira here? Would you like to say a couple of words in closing or anything like that?
Thank you, everybody, for your contributions. It was really wonderful to give up your time and to make this webinar a success. And we will post it on the YouTube channel shortly, once we've got the recordings sorted, if that's okay. Thank you so much. And you're welcome to join the Pediatric Oncology Special Interest Group. It'll be wonderful to welcome you all. Thank you.